Hello viewers, today I would like to acquaint you with the topic United Nations Population Fund UNFPA through my lecture. United Nations Population Fund, its origin. UNFPA began operations in 1969 as the United Nations Fund for Population Activities. The name was changed in 1987 under the administration of the United Nations Development Fund. In 1971, it was placed under the authority of the United Nations General Assembly. Its mission: UNFPA, the United Nations Population Fund, is an international development agency that promotes the right of every woman, man, and child to enjoy a life of health and equal opportunity. UNFPA supports countries in using population data for policies and programs to reduce poverty and to ensure that every pregnancy is wanted, every birth is safe, every young person is free of HIV, and every girl and woman is treated with the dignity and respect. The background of UNFPA: it began funding population programs in 1969. It is the world's largest international source of funding for population and reproductive health programs. The fund works with governments and non-government organizations in over 140 countries with the support of the international community, supporting programs that help women, men, and young people plan their families and avoid unwanted pregnancy, undergo pregnancy and childbirth safely, avoid sexually transmitted diseases, combat domestic violence, promote the equality of women. Together, these elements promote the human right of reproductive category, that is health, which is physical, mental, and social health in the matters related to reproduction and the reproductive system. UNFPA looks to improve the lives and expand the choices of individuals and couples. After time, the reproductive choices they choose, multiplied across communities and countries, affect the population construction and trends. In addition to the direct action, UNFPA raises awareness of these needs worldwide, advocates close attention to the population, and helps needy countries to formulate policies and strategies in support of the sustainable development. Since 2001, it has been led by Thoraya Ahmed Obaid of Saudi Arabia. Around 3/4 of the staff work in the field. UNFPA's work is guided by the Program of Action adopted by 179 governments at the International Conference on Population and Development in 1994. The conference agreed that meeting people's needs for education and health, including reproductive health, is a prerequisite of sustainable development. Its area of work: UNFPA is the world's largest multilateral source of funding for population and reproductive health programs. The fund works with governments and non-government organizations in over 150 countries with the support of the international community, supporting programs that help women, men, and young people voluntarily plan and have the number of children they desire, and to avoid unwanted pregnancy, undergo safe pregnancy and childbirth, avoiding spreading sexually transmitted infections, decrease violence against women, increase the equality of women. According to UNFPA, these elements promote the right of reproductive health, that is, physical, mental, and social health in matters related to reproduction and the reproductive system. The fund raises awareness of and supports efforts to meet these needs in developing countries, advocates close attention to population concerns, and helps developing nations formulate policies and strategies in support of the sustainable development. Dr. Osterman assumed leadership in January 2011. The fund is also represented by UNFPA Goodwill Ambassadors and a patron. How UNFPA works? UNFPA works in partnership with governments, along with other United Nations agencies, communities, NGOs, foundations, and the private sector to raise the awareness and mobilize the support and resources needed to achieve its mission. The fund is fully committed to be more effective, coherent, and better coordinated United Nations system that delivers as one, which is the essence of the ongoing United Nations reform process. Starting in 2007, UNFPA decentralized its operations to become more field-centered, efficient, and strategic partner to the countries it serves. Today, this end, it established 5 regional and 6 sub-regional offices in the field that help coordinate work in more about 150 countries, areas and territories through a network of 129 country offices. Donor contributions to UNFPA and the other income in 2010 reached a record of $870 million, up from $783 million a year earlier. 21 donors each made contributions exceeding $1 million, and the contribution from Netherlands, UNFPA's largest donor in 2010, totaled more than $119 million. Meeting the developmental goals. UNFPA works in partnership with governments, other agencies, and civil society to advance its mission. 2 frameworks guides its efforts: the Program of Action adopted at 1994 International Conference on Population and Development, and the Millennium Developmental Goals, a set of 8 time-bound targets to reduce extreme poverty by 2015. Because the dates for achieving these interconnected sets of goals and related targets are fast approaching, considerable work has been done to analyze what has worked, galvanize the support. The main goals of the Program of Action are: universal access to reproductive health services by 2015, universal primary education and closing the gender gap in education by 2015, reducing the maternal mortality by 75% by 2015, reducing infant mortality, increasing the life expectancy. These goals were refined in 1999. One of the most important additions concerned HIV/AIDS. HIV infection rates in persons 15 to 24 years of age should be reduced by 25% in the most affected countries by 2005 and by 25% globally by 2010. The fund promotes a holistic approach to reproductive health care that includes access to the range of safe and affordable contraceptive methods and to sensitive counseling, prenatal care, attended deliveries, emergency obstetric care and postnatal care, and prevention of sexually transmitted infections by promoting safer sexual behavior. Some of the UNFPA work involves the lead in providing supplies and services to protect the reproductive health. They also encourage the participation of young people and women to help rebuild their societies who are affected by poor reproductive health, which expands out into areas such as prevention of sexually transmitted diseases, including HIV/AIDS. The 3 core areas of focus. The 3 core areas of focus include the reproductive health, gender equality and population and developmental strategies, which are related to each other. Population dynamics, including growth rates, age structure, fertility and mortality, migration and more, influence every aspect of human, social and economic development. Reproductive health and women empowerment powerfully affect and are affected by population trends. First, population and development strategies. The fact that world population is expected to reach 7 billion people in 2011 has profound implications for development. Governments need to be able to gather adequate information about population dynamics and trends in order to create and manage sound policies and generate the political will to appropriately address both current and future needs. UNFPA supports governments in every aspect of this task, including censuses, surveys, and population and development related research and its analysis. Key areas of population trend focus includes migration, aging, climate change, and urbanization. The 7 Billion Actions campaign, spearheaded by UNFPA and its partners, is an attempt to engage people from all walks of life and places in the world in these issues as follows. Population situation analysis, state of world population 2011, facing a changing world, women, population and climate. Second, sexual and reproductive health. Working with a wide range of partners, UNFPA assists governments in delivering sexual and reproductive health care throughout the life cycle of women. Areas of assistance include voluntarily family planning, antenatal, safe delivery and postnatal care, prevention of abortion and management of its consequences, treatment of reproductive tract infections, prevention, care and treatment of sexually transmitted infections, including HIV information, education and counseling as appropriate on human sexuality and reproductive health. Prevention of violence against women, care for survivors of violence and other actions to eliminate the traditional harmful practices. Appropriate referrals for further diagnosis and management of the above. Improving the maternal health, Millennium Developmental Goals, is a key priority for UNFPA and the goal which lags farthest behind. Key initiatives in this area include the Maternal Health Thematic Fund, the campaign to end fistula, and numerous partnerships. The importance of universal access to reproductive health is underscored by the fact that it was added on the Millennium Developmental Goals target by the international community in 2005. Access to reproductive health care also demands what UNFPA calls reproductive health commodity security, the ability of all individuals to obtain and use affordable, quality reproductive health supplies of their choice whenever they need them. Expanding access to reproductive health care also relies on skilled midwives and other healthcare workers. Family planning. Globally, some 215 million women worldwide who would like to avoid or delay a pregnancy lack access to the effective contraception. Fulfilling the unmet need for the modern family planning in the developing world would reduce the unintended pregnancies from 75 million to 22 million. UNFPA advocates for the right of all people to voluntarily decide the number and timing of their children. It supports programs that improve access to and affordability of family planning services, offer a broad selection of choices, reflects high standards of quality of care, and are sensitive to cultural conditions, provide sufficient information about their use, and address women's other reproductive health needs. Therefore, it includes adding it up costs and benefits of investing in family planning, reducing the unmet need for family planning. Family planning, a global handbook for the providers. Third, gender equality and women's empowerment. The importance of gender equality and women's empowerment to development progress is underscored by the fact that this was selected as one of the 8 Millennium Development Goals. Beyond being a goal in itself, gender equality is also a driver for all the Millennium Developmental Goals and is intimately linked and specifically connected to goals to improve maternal and newborn health and reduce the spread of HIV. UNFPA's gender framework incorporates 4 strategic linkages that address critical factors underlying inequalities and rights violation: girls' education, women's economic empowerment, women's political participation, and the balancing of reproductive and productive roles. The fund brings gender issues to wider attention and promotes legal and policy reforms and gender-sensitive data collection. It works to end gender-based violence, including practices that harm women, such as child marriage and the female genital mutilation, as well as prenatal sex selection. We also raise awareness of women's specific strengths, vulnerabilities, and needs in relation to the variety of issues, such as humanitarian emergencies, climate change, and migration. UNFPA recognizes the rights, perspectives, and influence of men and boys and seeks to involve them in efforts to promote gender equality and improve reproductive health. Campaign to End Fistula. This UNFPA-led global campaign works to prevent obstetric fistula, a devastating and socially isolating injury of childbirth, to treat women who live with the condition and help those who have been treated to return to their communities. The campaign works in more than 40 countries in Africa, the Arab states, and South Asia. Ending female genital mutilation, UNFPA has worked for many years to end the practice of female genital mutilation, the partial or total removal of the external female genital organs for cultural or other non-medical reasons. The practice, which affects 100 to 140 million women and girls across the world, violates their rights to health and bodily integrity. In 2007, UNFPA, in partnership with UNICEF, launched a $44 million program to reduce the practice by 40% in 16 countries by 2015 and to end it within a generation. UNFPA also recently sponsored a global technical consultation which drew experts from all over the world to discuss strategies to convince communities to abandon this practice. UNFPA supports the campaign to end female genital mutilation with its guardian. Relations with the US government. UNFPA has been falsely accused by groups opposed to abortion of providing support for government programs which have promoted forced abortions and coercive sterilization. Controversies regarding these claims have resulted in a sometimes shaky relationship between the organization and 3 presidential administrations, that is, of Ronald Reagan, George H.W. Bush, and George W. Bush, withholding funding from the UNFPA. UNFPA provided aid to Peru's reproductive health program in the mid to late 90s. When it was discovered by the Peruvian program had been engaged in carrying out coercive sterilization, UNFPA called for the reforms and protocols to protect the rights of women seeking assistance. UNFPA was not involved in the scandal, but continued work with the country after the abuses had become public to help end the abuses and reform laws and practices. From 2002 through 2008, the Bush administration denied funding the UNFPA that had already been allocated by the US Congress, partly on the refuted claims that the UNFPA supported Chinese government programs which include forced abortion and coercive sterilization. In a letter from the Under Secretary of State for Political Affairs, Nicholas Burns, to Congress, the administration said it had determined that UNFPA's support for China's population program facilitates government's coercive abortion program, thus violating the Kemp-Kasten Amendment, which bans the use of United States aid to finance organizations that support or take part in managing a program of coercive abortion of sterilization. UNFPA says it does not provide support for abortion services. Its charter includes a strong statement condemning coercion. UNFPA's connection to China's administration of forced abortions was refuted by investigations carried out by various US, UK and UN teams sent to examine UNFPA activities in China. Specifically, a 3-person US State Department fact-finding team was sent on a 2-week tour throughout China. It wrote in a report to the State Department that it found no evidence that UNFPA has supported or participated in the management of the program of coercive abortion or involuntary sterilization in China, as has been charged by the critics. However, according to then Secretary of State Colin Powell, the UNFPA contributed vehicles and computers to the Chinese to carry out their population planning policies. However, both the Washington Post and the Washington Times reported that Powell simply fell in line, signing a brief written by someone else. He is Colin Powell at the United Nations. Christopher H. Smith criticized the State Department investigation, saying that the investigators were shown Pompton villages where residents had been intimidated into lying about the family planning program. Dr. Nafees Siddique, former director of the UNFPA, said her agency had been pivotal in reversing China's coercive population planning methods. But a 2005 report by Amnesty International and a separate report by the United States State Department found that coercive techniques were still regularly employed by the Chinese, casting doubt upon Siddique's statements. But Amnesty International found no evidence that UNFPA had supported the coercion. A 2001 study conducted by the Pro-Life Population Research Institute falsely claimed that the UNFPA shared an office with the Chinese family planning officials who were carrying out forced abortions. We located the family planning offices, and in that family planning office, we located the UNFPA office. And we confirmed from family planning officials that there is no distinction between what the UNFPA does and what the Chinese Family Planning Office does, said Scott Weinberg. However, United Nations members disagreed and approved UNFPA New Country Program in January 2006. The more than 130 members of the group of 77 developing countries in the United Nations expressed support for the UNFPA programs. In addition, speaking for European democracies, Norway, Denmark, Sweden, Finland, Netherlands, France, Belgium, Switzerland and Germany, the United Kingdom stated UNFPA activities in China, as in the rest of the world, are in strict conformity with the unanimously adopted program of action of the ICPD and play a key role in supporting our common endeavor, the promotion and protection of all human rights and fundamental freedoms. President Bush denied funding to the UNFPA over the course of Bush administration, a total of $244 million in Congressly approved funding blocked by the executive branch. In response, the European Union decided to fill the gap left behind the US under the Senbeck report. According to its annual report for 2008, the UNFPA received its funding mainly from the European governments. The contribution of UNFPA to the global response to AIDS is shaped by its mandate to reduce poverty, eliminate gender inequality, and ensure universal access to sexual and reproductive health. As a co-sponsor of UNAIDS and under the UNAIDS Division of Labour, UNFPA focuses its response on HIV prevention among young people, women and marginalized groups. It supports comprehensive programming for male and female condoms and advocates for the linking and integration of sexual and reproductive health and HIV policies, programs and services. UNFPA ensures that family planning and maternal health services meet the needs of women living with HIV. This includes interventions to prevent mother-to-child transmission and support for confidential voluntary HIV testing and counseling. UNFPA also works in many contexts, including humanitarian and post-conflict situations, towards the elimination of gender-based violence and prevention of HIV. It included sexual and reproductive health and HIV linkages, the evidence reviews and recommendations, global guidance briefs on HIV and young people, Make It Matter, advocacy messages to prevent HIV in girls and young women, assisting in emergencies in times of upheaval, pregnancy-related deaths, and the sexual violence SOAR. Reproductive health and obstetrics services often become unavailable. Young people become more vulnerable to HIV infection and sexual exploitation. Too often, the special needs of women and young people are overlooked in humanitarian emergencies. Within the coordination, interagency response to disasters, UNFPA takes the lead in providing supplies and services to protect reproductive health, with an emphasis on the special needs of vulnerabilities of women and young people. Both groups can figure predominantly in rebuilding peace or communities. UNFPA supports various data collection activities, including censuses to provide detailed information for planning and rapid health assessments to allow for appropriate, effective and efficient relief. It also assists stricken communities as they move beyond the acute crisis and enter the reconstruction phase. Conclusion. I would like to conclude that UNFPA's main achievements therefore are to be found in the following areas, that are capacity development, reinforcement of health system, along with the overall planning and implementation and evaluation of development programs. The UNFPA's assistance to the less developed countries is based on their needs as defined in their developmental plans. I sincerely hope this lecture proves to be informative and enlightening for all the viewers. Thank you.